Hey guys, today I'm just going to show you how to do a quad injection for testosterone replacement therapy. This is going to be a full guide and hopefully it shows you how to do it safely and pain-free. Right now, for those of you on testosterone replacement therapy, normally you would do an injection in your glute or your butt, right? But sometimes you want to give that a break and then maybe you can have an alternate spot to do your injection like your quad. Also, the quad is a lot easier to access. You know, it's your leg, it's right in front of you versus trying to twist around and getting to your glute. So a quad injection is handy as a backup if you don't want to do a glute injection. Now, before we begin, I just want to state that I'm not a doctor, so please consult your medical professional before taking any medical action. And with that said, let's get to the guide. Okay. So to start off, let's have a look at the equipment that you're going to need, right? Firstly, you're going to need your vial or your ampule of testosterone produced by a legal lab and as supplied to you by your pharmacy or doctor for your prescription. In this case, I am using the Sustanon 250 milligram 1 ampule by Aspen. Next, up over here, you've got the 25 gauge 1-inch needle, which is going to be used for injecting. That's usually got an orange cap. Below that, I've got the 18 gauge 1.5-inch needle. And this is optional. This is sometimes used for drawing up the testosterone before you inject. You use this needle to draw and then that needle to inject. Just because it's thicker, it draws the testosterone more easily, but it's optional. You don't have to use it. You can use a normal needle. It's just going to be a little bit harder. Next, we've got the 1 ml Lear syringe, and then below that the 2 alcohol swabs, and finally we've got this guy over here, which is a yellow sharp spin, and that's used for disposing your needles and your sharp items. So I'm going to do a close-up quickly just so that you can have a closer look. I'll zoom in so you can see everything that we have here and maybe the names and the info on it, and then we'll move along. All right, next, let's take a look at where we're actually going to be injecting in the quad, right? Let's locate the injection site. So if you look at the top part of your leg from the knee up to your pelvis, now imagine that area, that part of your leg is equally split into 3/3, right? You'll be injecting into the middle third. So you'll be injecting into the middle section and slightly to the side, roughly halfway between the top and the side of your leg, as you can see in the video below. So I'm going to show you a couple more pictures just to give you a rough idea of where the injection site is, but don't stress about this too much. It's quite a large muscle, so just make sure that you're in the general right area. A good way to check if you're there, if you're on the muscle, is if you have muscle, you can flex your leg and see where the definitions are and then make sure that you're in the muscle. Right. In the next step, we're going to prepare for the injection. So to start off with, make sure your hands are washed and clean. Then open and attach the large needle to the syringe. This is going to be used for drawing the testosterone. In our case, it's the pink needle, but it could be any needle that you decide to use. Next, we're going to draw the testosterone from the ampule or the vial, depending on what you use. In my case, I've got an ampule, which is already open. If you struggle to open your ampule, just check my channel. I've got a video to show you how exactly to do this. Also, if you don't know how to draw from a vial, there's a little bit of a technique to it. Check my channel for that too. Right. Now that we've drawn the testosterone, we're going to remove the air from the syringe if there is any. In my case, you can see there's a nice fat bubble that got in just because I'm a little bit distracted as I'm creating this video, but we're going to make it get to the top and then squeeze it out. Next, what you want to do is swap needles. So you remove the pink needle, whichever needle it was you used to draw, and then you attach the needle that you're going to use for injecting. In this case, it's the orange 25 gauge needle. Again, if you attach the new needle, the one you're going to use for injecting, and you notice there might still be a little bit of air in the syringe or in the sort of area between the syringe and the needle, then just squeeze it out like you did before. Finally, open up your alcohol swabs and have them ready so that you can clean the injection site when you inject. Right, that's it. Now we're ready to inject. Okay, so let's finally move on to actually doing the injection. So to start off with, you want to find the location we discussed earlier where you're planning to inject your injection site and rub it with an alcohol swab just to disinfect it. Then, take the needle and syringe that contain the testosterone and remove the needle cover. Hold the syringe at 90 degrees to your leg and firmly but slowly push the needle into your injection spot, your quad. Do not push in the testosterone yet. So, before pushing in a solution, you want to aspirate. And what that is instead of pushing the syringe in, you actually pull backwards on the syringe. And what this should do is it should draw air into the syringe, and this will help you check whether you are in a vein or not, which can be dangerous. Now, if you draw air, that is fine. That's what you want to see, right? But if you draw blood, then you may be in a vein or a blood vessel. Don't panic. Just pull the needle out, swap with a new one, and then repeat the aspiration process again until you do draw air the first time. Right, now if this is still unclear to you, then I've got a full video on my channel about aspiration and how exactly to do it. Just go check that out and then come back to this video. Right, so now we're ready to inject, and we simply push in the testosterone solution now. Don't worry about any air bubbles that might have come up when you aspirated. That's fine. Just push the needle in until all the solution is in your muscle. When you're done, remove the needle. And then grab the alcohol swab that you prepared earlier and just wipe the injection site just to keep it clean. And finally, remove the needle from the syringe and throw away any sort of needles and sharp glass objects, anything like that, you know, that kind of trash that's lying around, into your Sharpies bin. So, that's it. I hope you found the guide helpful. If you still have any unanswered questions about anything that was covered here today, you know, for example, aspirating or air bubbles and that type of thing, then just check my channel for videos on your question, because it's most likely that I would have done a video covering your question already in the past. However, if you don't find anything, then just leave a comment or a question below and I'll get back to it as soon as I can. Now, coming up in 2018, I will be releasing a free ebook guide on how to inject testosterone for TRT, right? I'll be covering glute injections as well as quad injections. So to be notified about that, just click the subscribe button here or go to my website, trthub.com, and just sign up to the newsletter. And that's the best way to keep up to date on all the latest developments and videos and guides regarding testosterone replacement therapy. And that's it. Thanks for watching. Click the like button if this helped you in any way, and I'll catch you in the next video. Cheers.